And welcome back to Holistic Healthline, your direct line to great health. And there's a lot of misinformation out there right now by some, a lot of people out there that are just talking about CBD oil, and nobody knows, what's right, what's wrong, is this real? So today, our guest is Stuart Tomc. He's Vice President of Human Nutrition and a National Educator from Plus CBD Oil by CV Sciences. Stuart is renowned for his knowledge of the research about CBD oil and information, and therefore he is our go-to person for the straight scoop.
He's the man.
The real deal about CBD oil. Hi, Stuart. Welcome back.
Hey, Dr. Jane. Hey, Peter. I am calling you live here. I am in Florida at the American Academy of Anti-Aging Medicine. And to your point, Dr. Jane, it is so confusing. I spent the day, Thursday, listening to several different speakers, professionals, doctors, MDs, trying to break it down. And I thought, I know we were going to talk about our latest PTSD study if we get to it at the end, perhaps. But, what I witnessed the other day is in real time so entertaining that as a physician and as an expert, both of you, in nutritional health, you really need to hear how crazy it is down here with the experts.
Are you just shaking your head?
No, because I'm so open, Peter, that seriously, when the wackiest stuff is being said, it's being said for a reason, right?
Yep.
Now, again, I'm not saying I agree with it, but there, for example, you went right for the sweet spot. So there was one MD, and, confident, beautiful, poised. One of these doctors that gets on stage. Have you ever seen this, Dr. Jane, at one of these conferences? Someone decides to show you a video clip of themselves while they're speaking. You know that routine, right?
Yeah.
You've seen that routine, right?
Far too often.
Here, I look good here, but look, in this clip, I look great. Now, here was the best part. She was up there after Dr. Hector Lopez, Dr. Amy Shunny. These are people that really know the subject. But here's the best part. She did not sit in on any of the earlier lectures. Have you ever seen that move, too, Dr. Jane? You walk in at the last second, you're going to speak on stress, and the person right before you spoke on stress, and you didn't even sit there to make sure that you weren't going to say the exact same thing.
Yes. That's a little embarrassing.
That one. Now, this is the best part. This professional, and she is a pro, was saying this. Hey, this stuff's great. There's no risks. There's no side effects. I don't use drugs. This is an MD. Here's what you do. I use this form. Here, y'all, just fill it out. Now, listen, everybody. She's talking to doctors for continual medical education credits. This isn't the sideshow where I come from, okay? Just to be clear. She's handing out a permission slip saying, here, this is my permission slip, and it's great, and just start using cannabis. Oh, and I'll send you the list, here, ready, of which strains treat which diseases and the genetic test to tell you which strain is right for the patient.
And that's all been studied and proven, and we know.
None of it. No, it's all hyperbole. But here's the best part.
Yeah.
Here's the best part. All revolutionaries are young. And as an MD standing up there saying, go for it, it made all of our scientists and doctors look so reasonable as we tried to lay out how nuanced this conversation is. This stuff is not for everybody. The good doctor was wrong, but she's young. The good news is she gave permission for people to learn.
Yeah.
Stuart, can you just let our audience know a little bit about CBD? What is it? And again, what are some of the things that it can be used for?
Well, CBD stands for cannabidiol, which is one of 100 different cannabinoids. Now, these are these funky, cool lipid signaling compounds found in cannabis that modulate neurotransmission, inflammation. They help to coordinate almost every physiological function in the body. It's quite fascinating how the system we have interacts with these weird compounds, generally only found in cannabis. So CBD is one of many. Most of us know that THC C from high school, Fast Times at Ridgemont High, but the CBD appears to be the polypharmacy, meaning it seems to be the most pluritropic. It works like a non-steroidal anti-inflammatory without the side effects. CBD seems to elevate your mood with the serotonin receptor without the side effects from Prozac. It seems to work at the GABA receptor without the side effects of Valium. CBD enhances the opioid signaling for pain without the side effects of opioids. So the reason that scientists in the world are losing their mind is that we found something that seems to be very, very, very effective for everything, seems to be safe, but to Peter's point, we're lacking the specificity. So this is pretty much like the early days, even though we've been studying the molecule since 1940. In people, we're just starting to get our hands around this. So here's the confusion. People are confusing CBD with our product, Plus CBD Oil, which is a hemp extract that happens to have some natural CBD. So this is where the confusion is, and that's what I saw yesterday, Doc. All of the doctors raising their hands all day long. What's the dose? How do you know? What's the proof? Well, guess what? We don't have any of that, and we have a fervor for consumption at the same time. That's what we should be unpacking.
Everybody, young and old, is buzzing about CBD. If they haven't tried it, they want to try it. And if they have tried it, they want to keep trying something different.
They're telling everybody they know, that they need to try it. The Plus CBD from CV Sciences, we've been seeing remarkable results. Some people very quickly, within like a few days. Other people, it can take several weeks.
Yep.
As far as some of the different, you mentioned some research as far as, let's say like sleep or anxiety. Is there research on that?
There's a little, and I love both of you and respect you so much, and the more controversial the subject gets, the more conservative I'm going to be, because you've got so many people exceeding the science. CBD itself, the molecule, you go to pubmed.gov, there's a pretty convincing body of evidence, and most of it is conducted on an isolated molecule of just the CBD portion and not all of the other cofactors found in nature. Now, the cheap argument is to say the natural stuff is better. That's not fair, because the FDA-approved CBD is natural, and it's a remarkable compound. For people like us, you made an excellent point. There are case studies. There are case reports. There's an open-label pilot trial with 79 people that showed an 80% reduction in anxiety with 25 milligrams per day. So that's doable. Here at the American Academy of Anti-Aging Medicine, at the Emerging Clinical Evidence and Effects Workshop, Dr. Amay Shunny, and we should have her on your show, Dr. Shunny talked about stress, adrenal health, women's health in particular, and the ECS and HPA connection. She says as a clinician for 4 years, an MD in Santa Cruz, that she's getting results with 20 milligrams a day for really treatment-resistant stress. So that is doable, and that's reasonable. But let's be clear, we're now getting a signal that it's time to do an RCT. So here's some breaking news. We are getting ready to start a randomized control trial on our gold soft gel, probably 100 patients. And we have a randomized control trial that should be done soon that will give us some supporting claims, like may help support a healthy stress response. So we're pretty much there at the base of the pyramid.
That's exciting, because I think that's part of, as you said earlier, that's part of the problem. There hasn't, as of yet, been a lot of research that this kind of exploded into the market, and everybody got kind of ahead of the horse.
Yep.
In trying to figure out who can use it, when can it be used, what is the dosage level, and it's so great that CV Sciences. That's part of what we love about your company, is that they are into the research and not just the willy-nilly stuff that some of the people are spreading out there.
Well, I think there's even more, and it's really exciting to share this next part.
Well,
with all the supplements, 35 years
Stuart,
you've done this, both of you.
I hate to jump in here, but when you say the next part, that means I know you. You're going to be talking a little bit, for a little, and I don't want to interrupt you. So we're going to take a quick break, and when we get back, then we want you to get into the next part. We'll be back in a moment
All right, thank you both.
with Stuart Tomc from CV Sciences and Plus CBD Oil. Back in a moment. And welcome back to Holistic Healthline and our super guest, Stuart Tomc. Again, he is Vice President of Human Nutrition and National Educator from Plus CBD Oil by CV Sciences. And now, Stuart, on to the next part.
The next part is it'll never stop. Here's what I mean by that. When you start diving into the complexity and the variability of the ingredient, remember in the past when we used to first talk about probiotics, some were alive and some were dead. Some had to prove that they were alive, and some ended up being dead. And then over time, probiotics in general have gotten better, the higher quality ones. Would you agree with that statement?
Yes.
Okay. Has fish oil quality since Nordic Naturals, just the higher quality brands, everybody just raised the level of freshness, and you're pretty much dealing with similar products. Now we're splitting hairs at this point. Would you agree with that?
Yes.
Okay. That's happening with everything, which is great because it empowers the patient. And the doctors like that because there's not the random variability when they say go take this or go take that. They're actually going to get what the doctor recommended. That's not happening with cannabis or hemp because of the vast variability from product to product to product to product. So it's easy to say, oh, each product is different. In this case, I've never seen an opportunity to exercise your brains and your nuance-seeking meter to figure out what you are taking, number one. Number two, the next wave of this will be the genetics, the SNPs. There are already papers out there that are listing the SNPs, and you can look them up and find out, are you more or less likely to test positive on a drug test? Are you a good metabolizer or a poor metabolizer? The transporters that move the cannabinoids sideways across the cell membrane, are those efficient? Those are rate-limiting factors. So we're going to find nuance after nuance after nuance. So in the final analysis, if it works for you, it may not work for somebody else. More than anything we've ever seen, do you two agree with that?
We have seen that in our practice. You get some people that have a response that is, I call it magical, like it's really unbelievable. And some people that doesn't do as much.
That's great. No, that's great. No, that's wonderful because that's medicine if it ends up being medicine. If it's wellness right now, that's great because with dietary supplements, our job is to keep healthy people healthy. The endocannabinoid system has a resting state. And these things, these hemp extracts, appear to help tonify the endocannabinoid system. Now, you can get up to, say, 100 milligrams with our product and not have problems with liver enzymes going up. However, if you want to start getting north of that, which may be needed for certain conditions, you're going to be needing to be under the care of a professional. And that's the biggest risk, is that people can't seem to see that there's a place for wellness, and then there's a very powerful place for these cannabinoids in medicine.
And so they're just different levels.
Yes.
And what's exciting is that CV Sciences, I think, as a company, is aware of all of this and not just, here, I'm going to sell you stuff just for the sake of selling you stuff. We actually want you to be healthy and well and to have product that is beneficial, and have to do the research and to understand the research. Quickly, I just there was a study about the the treatment of post-traumatic stress disorder utilizing CBD, because this is a big factor for a lot of people right now. Is this something that you're aware of?
Well, this is exciting work. This is Dr. Scott Shannon. It is a preliminary study. There are only 12 people or 11 people, I think, in the study, and it's an indication that more work is needed. Now, that study was conducted on our product. That's why I want to be really conservative, because you can see somebody, hey, look at this, is published, they used our product. It's working for PTSD. What it says in the study is to combine the Plus CBD oil with therapy. Let's be clear.
Yeah.
What's exciting about this, it seems to help with the brain resting state, neuroinflammation, extinguishing fear, memory, and bringing you back into balance. So the doctor that did that is the doctor that's going to go on to do a 100-person randomized control trial. That's exciting.
That is exciting. What was the percentage of benefit that people found just in this little limited study?
It was alarming, like 80%.
Yeah, yeah, yeah.
That's why we want to be careful, because I've seen this. You've both seen this over the years. People really run with this stuff. The great news is it's live and available for free in the Journal of Alternative and Complementary Medicine. The scientist to look up is Scott Shannon, SHANNON, MD. And Scott's work is really remarkable. He has a center in Colorado, and he's also one of the lead principal investigators for the MAPS program, which is studying MDMA and assisted psychotherapy for severe post-traumatic stress disorder. Have you been following any of that at all, MAPS?
No.
Listen, this is the Multidisciplinary Association for Psychedelic Studies. So in his clinic, they have a phase 3 clinical trial for MDMA. This is bleeding edge stuff. So this guy, my friend, Dr. Shannon, he's one of the world experts on integrative psychiatry, looking for ways to deal with treatment-resistant depression and anxiety. Now, he's very excited about what we're doing. I just want to make sure to contain that enthusiasm, because you can't say, Plus CBD oil for PTSD, look at the study. That's what it looks like.
Yeah.
Yet we can't say that.
Is there any talk in the industry, within the confines of CBD, the different companies? Is there talk of any standardization? Coming saying, all right, we're going to call this, labeling by dosage or labeling by total contents, or is there any coming together? Because again, there's everything out there.
May 31st, FDA meeting. Our Senior Vice President of Scientific Regulatory Affairs, Dr. Duffy Mackay, just was awarded a speaking spot. I think there are only 17 spots out of 400 possible applications. In any case, May 31st, the FDA will start speaking. Currently, any product that you're using should be labeled to the Federal Code of Regulation 21 CFR. That's the dietary supplement labeling laws. Our products are vetted by FDA lawyers, that labels are accurate and appropriate, and the way we're doing it is appropriate and lawful. Many people are selling cannabis as hemp products, and that adds further confusion to regulators.
Yeah.
So it is the Wild West. Buyer beware, but I want to make sure that we're clear. Homemade products or poorly labeled products might work very well. That doesn't mean that they're bad. That means they might not be ready for prime time commerce.
Stuart, one quick question. Had somebody ask me the other day, as far as traveling across the United States with CBD, is there any problem with that, with the hemp-derived CBD?
Well, there was a woman at Disneyland the other day that got arrested. I'm serious. It's embarrassing. I heard that in Dallas, Fort Worth, they were asking people that had CBD. They were telling them that they might call local authorities. So I just want everyone to know that this is in flux, and to be very, very transparent about this. Federally, we're making unbelievable progress. For crying out loud, the plant is no longer a controlled substance.
Yeah.
The plant is no longer the local thing. Let's look at it like alcohol. Federally, there are laws, and then there are local laws. And I think it will be evolving more like that.
And is it possible to be tested positive for those who are like government workers if they're using...
Absolutely. That was a big knockdown, drag-out session here the other day. Look, it's rare and it's possible, so don't do it. It's rare, but possible, so the answer is no. We sold 2 million bottles last year. We had 699 adverse event reports, not one serious. A tummy ache is an adverse event report.
True.
A couple of people claimed that they had tested positive. It's not worth the risk. Use the topical balm. Topically, CBD is so effective. Do you know there's a drug company pursuing topical CBD gel to compete with GW Pharma? Did you know that?
No.
Zenerba Pharmaceuticals, and there's Zenerba gel. They found out that the cannabinoid receptors in the skin work like really well. So, seriously, if you're worried about drug testing, get the gold topical balm. Rub it on your shins. Rub it on your back. It's our second best-selling product. So I thought it was all anecdotal, right? It was a massage. You felt better. Somebody touched you. This stuff actually works.
Well, Stuart, unfortunately, got to let you go because we run out of time. But again, Stuart Tomc from CV Sciences and Plus CBD Oil. If you want more information, I would suggest you go to their website because this is awesome stuff.
Thank you as always, my friend.
Oh, I miss you both. So great to hear your voice, and thanks for having me on again. Bye-bye.
Bye-bye.
Take care.
Busy man, too, so he took time out of his schedule. But again, there's so much misinformation about the CBD oil. Be careful. Be careful of certain companies out there that are not, giving you the straight information. But we have found with CV Sciences that, again, they're on top of what's the leading in the industry.